Hi, my name is Mark Philippon. On behalf of my team in Vail, I'd like to thank you for allowing us to make some comments on our research article that we published in JBJS, a comparative study of labral repair and labral reconstruction, a 2-year outcome of primary arthroscopic surgery in patient with FAI. In recent years, labral reconstruction has been applied in primary hip arthroscopy in instances in which there is inadequate natural labral tissue. This procedure involves the debridement of non-functional or degenerative labral tissue with substitution of other autograft or allograft tissue in its place. Some researchers have hypothesized that the torn labral tissue is pathologic or a pain-generating tissue and should be removed. Some short-term outcomes at select centers have been published that appear to show improved PROs and good survivorships. However, in our clinical practice and research program, we observe that labral reconstruction doesn't restore the hip fluid seal as well as labral repair. We pursued this study in our large prospectively enrolled data registry to compare clinical outcomes between labral repair and reconstruction in the primary hip arthroscopy setting. For our study, it was important to ensure that the labral repair and labral reconstruction patients were placed as even a playing field as possible. To accomplish this, we pursued a unique 3-stage multivariable modeling approach. Several technical statistical modeling steps had to be navigated to produce verifiably robust results. First, we developed a process to perform propensity score weighting within multiple imputation sets. This was important to address the primary aim of the study while not losing information or inducing bias due to missing data. Secondly, we discovered that it was important to trim the several most extreme propensity score ways to ensure reliable model behavior. In addition to the primary modeling results, we performed a sensitivity analysis to incorporate the risk for subsequent surgery simultaneously with the post-operative patient report outcome. These models can be found in the paper's supplementary materials and demonstrate an even more striking clinical benefit to undergoing primary labral repair compared to primary labral reconstruction. Our study supports the use of labral repair in the primary setting of labral tears and suggests that labral reconstruction should be reserved for more advanced labral pathology, such as revision cases. To ensure generalizability, it would be beneficial to validate the study's finding at a separate center or in future patients. Thank you.